Peace and greetings to you. This is Omar Abdul Malik, Physician Assistant Health Educator. I'm here at DC Medical Supply and Uniforms LLC, located at 5922 Georgia Avenue Northwest in Washington, D.C. I'm here because I got a request to cover the different types of shoes for the allied health care. So if you're in school, if you're a medical student or a physician assistant student, or nursing student, it's a good idea to learn the different types of shoes that you can wear. This is called a clog. I think most of us know what this is. This is a plastic. This is made out of plastic material. It has a slip-resistant sole. All of these shoes do, actually, slip-resistant soles. That's important because, trust me, when you're in the hospital, especially depending on the type of clerkship or the type of work that you're doing, sometimes the floors can be very slippery, especially if they've been waxed or something like that. If you are doing emergency medicine in particular, you're going to want something with I would highly suggest you get something with a non-porous covering on it, a non-porous material. Not something like this. This is more of a sneaker. This is by a company called Drew. These are very lightweight and very comfortable, but as you can see from the top, it's a material mesh. I can tell you, somebody who's participated in and run codes, when you're doing chest compressions on people, sometimes they may vomit. You're going to get various bodily fluids on you, especially if you're in emergency medicine. If you're doing trauma surgery, there's going to be blood, poop, pee, various other bodily fluids that will come from the patient upon which you're working, and they will get on your uniform, but certainly on your shoes. So you want something that you can wipe off in a chlorhexidine cloth or a bleach cloth. And you can still be stylish. These are very stylish looking clogs here. Again, with the this doesn't have the slip resistant sole on it, but you can see from the there's a shiny material here. It's almost like a patent leather. You can wipe these off. If you're a nursing student, you may be required to get white shoes here. I started out my allied health career as a nursing assistant, and we were required to get white shoes. And I got white sneakers. I got shoes like this, but these can be difficult to get in and out of, depending on what you're doing. So the clogs may be a better option for you. And this is kind of a one piece. It's a molded one piece here. If you can see the texture of that, it's almost like it came out of a mold of some kind. Again, with the slip resistant soles on them. These shoes sell for the price range looks like it's anywhere from $20. These are $100, but this is leather. Yeah, so you have a nice leather top for $100 versus a molded plastic top for $20 to $30. If you want to go with something that's higher quality, you might like the leather shoe. Your feet will smell with plastic. Any type of other synthetics too. I can tell you from experience. This is a popular men's shoe. I've seen a lot of the attendings wearing these, especially in surgery. These are aesthetically appealing. It's made of leather. Again, I would not suggest wearing these if you are in the ICU or in the trauma bay. It's not particularly. It's porous material. So if you get blood on them, it will actually kind of meld into the shoe. Let's see. These, I've got a pair of shoes like this with the this is called genuine grip, slip and oil resistant. It's got a good it's got a good top to it, so you can actually wipe it off with a bleach or a chlorhexidine wipes. So you want something, you don't want to bring anything like this home to your to your loved ones. I have a pair of shoes that I actually keep in the hospital. So I'm a hospital's physician assistant, and I was running a code once, and this guy just started vomiting profusely. So we had to turn his head during the code, and his head was turned in my direction. So it was a projectile vomit too. So it got all over me, soaked into my shoes. I didn't have a pair of shoes that were the material was porous material, so it was kind of gross. There's a lot of infectious. Um, Sometimes people have infections. They're on something called contact isolation, so you definitely don't want to come into contact with their bodily fluids. So it's important to have non-porous material. You also want something with what's called a microbe shield. I'd never seen this before. So this is controls odor, staining, and deterioration. This is what is this? This is a lightweight shoe. This material, it's non-porous, but it's not what I would consider the best quality, because it's gonna tear fairly easily after a relatively short period of time. You can get something more like this. This is more like a patent leather. The good thing is if you're somebody who would like to be a little bit taller, there's like a 2 or 3 inches of heel that you have here. I'd be about 6 foot in these shoes. This shoe sells for $60. It's got a zipper on the side. You want something, again, that's comfortable if you're going to be on your feet for a long time. I work pretty long shifts that range anywhere from 8 to 12 hours. So, and I'm constantly moving. If a rapid response or a code is called, I've got to be there quickly. So I need something that I can walk quickly or even sometimes run in. And for those of you guys that are in med school or PA school or nurse practitioner school, when you do your surgical rotations or your emergency medicine rotations, you're going to be doing running. Trust me, because you have to get there before the resident and the attending. So you want something that's relatively comfortable to move in. I personally wouldn't suggest anything with an open back on it, like this shoe, because it's like running in flip flops. But this has a strap that comes up and down. I don't know if you can see this here. Kind of like that. That moves. So I'm doing this with one hand. Yeah, so the strap comes behind the ankle. So that might work, but you also don't want your foot exposed. You don't want you want to have a good barrier between the person's bodily fluids and your foot. So something that covers the foot as good as possible. A shoe like this in particular. So the 3 things I would look for in a shoe for healthcare workers would be the type of material that's covering the foot, the extent to which the foot is covered, the type of sole that you want. You want something that's slip resistant. You want something that's non-porous. You want something that's comfortable to move around in, and fashionable if you're into that, But just from a standpoint of functionality, non-porous material, slip-resistant sole, and covering, giving you good protection from bodily fluids. Yep, so that's it. And you can expect to pay anywhere from $3, or not $3, but $30, maybe $20 to $40 for a lower end shoe. Maybe you could go to Walmart or something and get them for $10 to $15, but that shoe's not going to last you long. To a good quality shoe, which is going to cost you anywhere from $80 to maybe $150. But those shoes are going to last you for a long time. But I hope you all found this helpful. Again, I got to thank the Raffi family at DC Medical Supply and Uniforms LLC, located at 5922 Georgia Avenue Northwest, Washington, D.C. 20011. I hope you all found this informative. Please subscribe to my channel if you have an interest in careers in allied health or how to get into physician assistant school. Take care. Peace.